Today, the Houston Health Department reports 777 cases of COVID-19, bringing Houston's total to 111,211. There are, unfortunately, 3 more people who have died as a result of COVID-19, bringing the city's total to 1,530. Each one of these individuals represent families within the city of Houston. The positivity rate is also up this week in comparison to last week. It is now 11.2% compared to 10.5% last week. And again, it is a reminder that it's important for us to blunt the progression of this positivity rate and then to start working to bring it down. As a result, I'm urging everyone to please get tested before Christmas Eve. Please get tested. There are many free testing sites very close to where you live. More importantly, please, I'm asking people to cancel your holiday gatherings. If you've planned to gather, especially outside of your immediate household, I'm asking that you delay those activities. To avoid a surge on top of a surge, postpone traveling until sometime next year. I know a lot of people are flying from here to there. I just don't think that is a wise thing to do right now. Cancel holiday parties and receptions, including those at your home. Wear your mask, wash your hands, and get tested this week. There is, of course, hope on the horizon with the approval now of 2 vaccines. This week, the Houston Health Department is scheduled to receive 3,000 doses of Moderna's COVID-19 vaccine. In addition to that, the Houston Fire Department is also scheduled to receive the same amount, and then I'll let Chief Pena speak to that shortly. The Health Department will distribute the vaccine in accordance with the vaccine allocation guiding principles established by the Texas Department of Health. Phase 1A of the Texas Department of Health plan focuses on making vaccines available to healthcare workers, including public health staff directly involved in administration of COVID-19 testing and vaccinations. And the Health Department is coordinating with the home health care agencies, long-term care facilities, and EMS providers to serve Phase 1A populations that are not yet connected with vaccine providers. In addition to that, her task force is putting together another advertisement media campaign to encourage people to get vaccinated. And I think the award-winning producer, Susan Christian, along with her co-director, Shannon Buggs, have put this television commercial together along with Denzel Washington. We can have the commercial. I am proud of how many Houstonians have responded to this pandemic. Now that COVID-19 vaccines are becoming available, continue to mask up, social distance, and follow health protocols.
As trusted healthcare professionals,
we're here for you.
We know some folks have concerns about the vaccine.
And we're working together with the mayor to address them.
Let's have a conversation about the vaccine.
About the science and the facts.
And stop the rumors.
You bring the questions,
we'll bring the facts. Because the truth can save lives. Thank you so very much. And now let me bring up the co-star of that commercial, Dr. David Persse.
Thank you, Mayor. I don't know about you, I'm still waiting for my SAG card, but we'll see. So I just want to say a little bit, so we've been in the media, there's been a lot of talk about what's going on in the UK with a new variant of the COVID virus, of the mutation. And it's important that everyone understand it appears early on that the virus, the new mutant virus, does not appear to be any more lethal. It doesn't cause any more serious illness, doesn't cause any more death. The change appears to be that the virus is more easily transmitted. And if you recall, we saw this back in late spring, early summer last year. Also in Europe, there was a mutation. So this is the second significant mutation to occur. And this is important because I want everyone to understand what happens. Anytime somebody becomes infected with the virus, their body starts making copies of it. And this is why we get so much virus, we can then spread it to others. Every time a cell makes a copy, there's a risk that it will make a mistake and that it will make a copy with an error in it. Well, that error if it is functional enough that that new virus can propagate, that's called a mutation. And so every time somebody becomes infected, we run a risk. So of all the many, many, many reasons we've talked about why people don't want to become infected in the first place, now here's yet another one. So I'm looking at this, of course, I look at it from a worrisome standpoint, is that we've now had 2 significant mutations that have caused the virus to spread more easily, but have not made it more lethal. And so what we really don't want to have happen is to have a virus which is easily spread and makes people sicker or is more lethal. So yet another reason why we should all be very, very diligent about making sure that we protect ourselves. Now, at the same time, I want people to understand, this new virus, the new version of it is not more lethal. It does not make people any sicker at this point. And also importantly, it appears that from those folks who are the scientists here, that it appears that the vaccines will still work against this new mutation. So those are all very good news, and those are all important news. But I just want to underscore there's yet another reason for folks to protect themselves and not get infected in the first place, because certainly you don't want to be the one whose body inadvertently makes the mutation that causes even more problems, right? And then the last thing I want to point out is that we talk about just to give you an idea as to how much more easily this virus is spread. We've talked about the R value. You see that the mayor has talked about the R value, and we get from the TMC, if that number is greater than 1, the virus spreads more easily. If it's less than 1, the virus is slowing down. And it's really a value of not only of the virus, but also how it's behaving in the community. So the numbers are early, but with this new mutant, it appears that it might be in the neighborhood of 3. So that is a significant increase in its spreadability. It's limited to southern England, southern UK at this point. And those officials there are on top of it. And so I heard on the way over here, apparently, that France is not letting anyone from England come. So there's some degree of international quarantine going on. And let's hope that they're able to get on top of it and stuff. But the bottom line is, even in the UK, in order to stop that, individuals are going to have to take responsibility and do whatever it takes at the individual person level to stop the spread of the virus. And Houstonians, we've done this. We've done it twice. Our numbers are going up now. It's time for us to do it again.